and saw whether they would have any benefit. And what we found is that a very brief yoga module 3 times a week produced a significant reduction in both burden and as well as improvement in functioning in these people who are caregivers of patients with schizophrenia. Of course, I need not mention that there are several barriers which prevent routine use of yoga for patients with schizophrenia, the most important ones being access to yoga teachers, as well as the need to come for a period of time, maybe 2 weeks or 4 weeks, to the yoga center. That's one of the limitations among several others. So if I would summarize, I would say that yoga improves symptoms and functioning in outpatients with schizophrenia. It is better than exercise and wait list for negative symptoms. It also improves both social and neurocognition, and acutely ill inpatients also yoga is better than exercise. There are of course barriers which limit use of yoga in schizophrenia on a routine basis, and I have not talked about the mechanisms here. If you have the chance to listen to Dr. Gangadhar's lecture tomorrow morning, he would be going into the mechanisms of the effect of yoga in both psychosis and depression, but some of them include mirror neurons and oxytocin. Particularly the oxytocin is linked to the social cognition, and a brief yoga module also helped people who are caregivers of people with schizophrenia. Now let me come to yoga for depression. Of course, this is one of the earliest studies done with the Art of Living organization of Sri Sri Ravi Shankar, which showed that Sudarshan Kriya Yoga done 3 or 4 times a week was equivalent in terms of antidepressant efficacy to a fairly standard antidepressant called as imipramine. Of course, this was a 3-arm study with 3 arms. The 3 arms were Sudarshan Kriya, imipramine and electroconvulsive therapy or shock treatment. For this, these were patients with fairly severe mental illness or major depression, and although ECT was superior, the other 2 arms were almost similar, as you can see in the graph. So yoga has an antidepressant efficacy. This was published way back in 2000 in the Journal of Affective Disorders. And also similar studies at NIMANS looking at which is the important part of the Sudarshan Kriya. They gave the full package to some people and took out some of the parts of the module and gave the partial Sudarshan Kriya to some other people, and what they found is that the full, it is like a dose response curve. So people who did the full Sudarshan Kriya had more benefit than the people who did the partial one. And similarly in people with alcohol withdrawal who also have a lot of depressive symptoms, yoga reduced the amount of depression quite significantly. Even though stopping alcohol itself leads to reduction in depression, yoga had an effect over and above that. So if you look at some kind of a meta-analysis, if you look at the pooled studies, the effect size in favor of yoga is 3.25, which is very, very significant. A recent study at NIMANS, published after, of course, that meta-analysis, also showed, this was a study where we asked people to choose. They could only do yoga, they could do both yoga and take medication, or only take medication. Although it's a fairly small sample, if you look at the yoga only group, they seem to do as well as the other 2 groups, if not better. And I would just maybe link you to, again, Dr. Gangadhar's talk tomorrow to understand the mechanisms. What we found is that in the people with depression, there is again cognitive deficits which improve when the depression gets better, and the yoga is related to both cognition and a brain-derived neurotropic factor, which is an important marker of neuroplasticity in the brain. So, and this has been well recognized, like the NICE guidelines in the UK. The CanMat guidelines also from Canada have included yoga as a intervention for depression. So if I would summarize yoga for depression, I would end by saying that yoga is efficacious as a sole or adjunct treatment in major depression. It improved cognition in depression, and antidepressants' effects seem related to the improvement in cognition, and the neurobiological mechanisms here may involve facilitation of neuroplastic mechanisms. What are the implications for us as clinicians? Both theoretical and practical evidence suggests that yoga is useful in schizophrenia and depression. particularly those who don't respond fully with the standard treatments which are available, and of course some issues need to be sorted out to provide yoga to more people suffering from these disorders. There are of course problems I need not probably explain to this audience about the issues with yoga research, blinding, placebo, what is yoga, what is not yoga, and whether RCT is the best method to evaluate something which is time tested as yoga is always a very difficult question to answer. Of course, the answers will only come if yoga professionals and medical professionals join together and do more studies. Like Dr. Sagar was pointing out, endocrinologists and psychiatrists work together. Similarly, the yoga therapist and the yoga community has to work together with the medical profession to do joint studies and sort out some methodological issues in terms of standardization of yoga modules which have to be used across studies. Of course, service delivery, India is still, with all this globalization, India is still a country of the villages. How do we reach yoga there remains a question that has to be answered. Thank you.
So we have had again a lot of noise in the back. So we have had Dr. Savita Shri Ranti talking about common mental disorders. She emphasized that there is a preferential role for non-pharmacological treatments, and yoga could potentially be one. And she highlighted that common mental disorders are indeed common and they could be recognized and treated, and of course preferentially with non-pharmacological disorders. And Dr. Rajesh Sagar talking about one of the common mental disorders which is much more prevalent in an illness which is a lifestyle disorder, depression, and when they coexist can complicate our life. And now that in this very important conference both the areas are addressed, we need to pay attention. And Dr. Varamballi highlighted how evidence can be built in terms of employing yoga in the treatment of severe mental disorder, schizophrenia being an example, a common mental disorder, depression being an example. I'll stop here. We have time for a couple of more questions. If anyone wants to ask questions, please go ahead and put your questions to the speakers. Any questions? Yeah, there you are. You have to be louder, sir. We have no mic here.
I had a question. When we talk about depression, that is a very different kind of symptoms where people go into a shell and all. When you talk about schizophrenia, so that is person is more hyper and too aggressive and all those issues. So both are totally different symptoms, and we are talking about yoga treating the both kind of problems. So that is one question, how it is possible, because in allopathy they say both they give those antidepressant, they say that we suppress, we increase dopamine and serotonin, those kind of neurotransmitters. And when we talk about schizophrenia, they try to block those these neurotransmitters. So according to allopathy, mechanism is totally different. I mean, effect is different in the brain. And so how come this yoga can treat both at a given time? That is one. Second thing, whatever studies have been done till now, why we have not measured the brain effect on of yoga in schizophrenia patients or in depressant people? One is that. And second, what we are talking about, there is an improvement, but we are not talking about complete relief from the problem. By yoga, are we saying there is going to be only limited benefit, not the cure? there is no study wherein it has been continued for say 1 year time or 5 years time and showing the result. Like this is it now. This is the solution for the problem. So this is my question.
Okay. Just to summarize the questions, I think the first point was schizophrenia, a person can present with agitation, aggression, and so on, whereas depression, the people are quite low in mood, inactive, hopeless, etc. They sort of appear to be like opposite conditions, and how can you use yoga for both the conditions? That was one of the questions. I'll start answering just one or two things, make few points, and pass on to my colleagues to address lots of questions you've asked. Very good questions. If I can give an analogy of the CBT, which I talked about, cognitive behavior therapy, they use the same thing in schizophrenia, panic disorder, or social phobia, or even depression. So essentially, the underlying concept of CBT is to deal with, say, cognitive aspects and behavioral aspects, but it works in all disorders. Similarly, there's no reason why yoga cannot work in all the disorders. And yoga may not have only the biological mechanism. One of the biological theories is dopamine is reduced in depression, whereas yoga can increase it, whereas in schizophrenia, the neurotransmitter changes might be different. But yoga may act on various other ways, and we do not fully understand how yoga acts, and it may not just be the biological mechanism. But I'll pass on the mic to other colleagues to add on.
Yeah, it's a good question, but you have to understand that the yoga that we would teach for schizophrenia and the yoga that we would teach for depression are not the same. They are completely different modules. For a very simple example, in the module that we would teach for schizophrenia or psychosis, there is no meditative component, because it is known that meditation is a hyper-dopaminergic state, and like you said, dopamine is already elevated in psychosis. So the yoga module that you would use for these patients, if you ask any of the yoga therapists, they would design a totally different module for these two conditions. They would use possibly more of activating kind of asanas and pranayama, say the Sudarshan Kriya in depression, whereas in the schizophrenia we would use more of calming kind of technique. So that is one part of the answer to your question. But the neurobiological mechanisms of action of these two, the yoga and different mechanisms, is also different. See, ultimately it's a process of bringing balance or samatvam or whatever you want to call it. So what is disturbed in depression seems to be the ability of the brain to repair itself, or neuroplasticity. Whereas in schizophrenia it is more that it is an imbalance in neurotransmitters in terms of what controls our emotion or the limbic area. So the yoga that you would design would be totally different. And like Dr. Savita Shri was saying, say for example, a medicine like olanzapine works very well even in depression. Although it's an antipsychotic, at lower doses it works very well in depression. So it's not that one medicine which works here cannot work there. So that's not the thing. So, but the yoga is entirely different. In response to your second question, why we have not, or nobody has really looked at long-term brain changes, there are several studies which are in progress, but the primary difficulty is two things. One is to get people to come or do yoga for that time and come back for follow-up is extraordinarily difficult. Just to give an example, in that study that published, that was picked up by the NICE guidelines, to get 120 patients to come for 4 months, we had to take in at least 1,000. So that's a 1 in 10 ratio of people screened to people joining the study. So it's very, very difficult to actually do a long-term or a 1 year or a 5-year study. But it is not true that brain mechanisms have not been studied. In fact, several imaging studies have been done looking at neurotransmitter changes. Although there are again funding restrictions mean the numbers are fairly small. So hopefully that will be remedied by some studies which are coming up. One of them is the DBT welcome study, which Dr. Gangadhar was telling that we plan to follow up these people for at least a year. That's the study which will come. I hope I answered some part of your question.
Just a brief, I think, response I will give. I think that's a very, very important point you have raised, that the neurobiology basis and some of those psychiatric disorder and all. Just let me explain to you that psychiatric disorders are a bit different from physical disorders. Like, say, for example, I gave the example diabetes. Like, you know, diabetes, sugar levels are high, you will make them diabetes. Blood pressure level high, 140, you will make the diabetes, you know. It's not the case for psychiatric disorder. Like, even for some of the biological markers are there, imaging, but they are not foolproof method. It's not one-to-one relationship. You know, we need to understand that. And perhaps what research has been done, you know, it's only neurobiology based maximum last 10 years, but again, it's not one-to-one, you know, though, Dr. Shriram talked about BDNF and, you know, some of the biological are being done, you know, NIMHANS lab. Perhaps you may hear a lecture tomorrow on biological basis, but, you know, but we have to understand the difficulty also in that it's not one-to-one for psychiatric disorders.
Yeah. If there are no questions. Yes, sir.
In village, farmers commit suicide, and also students in examination time also commit suicide. Please give me your expert ideas for society.
Suicide in students, can yoga help?
Yeah, I mean, it's a difficult question to answer because suicide, again, like Dr. Sagar was saying, is not a unitary phenomenon, and people commit suicide because of various things. If the person is contemplating suicide because of clinical depression, yes, definitely both yoga and other treatments can help. If it is a social situation which is making the person commit suicide, then the management of that, of course, would be entirely different. He may not need medication or any other things, but in depression, in the people who are suicidal, yes, treatments can help, but you are not going to get randomized controlled trials. I can't foresee any such things because nobody would be able to include such patients in the study because they are suicidal, and the risk of not giving them one treatment or other will be too much. So I don't think you will get an answer to your question through RCTs, but if it is because of depression, yes, definitely yoga and other treatments can help.
Okay. Yes, sir. Here, we'll give a chance to this person.
Sir, can yoga help in changing the mood cycle for any person to help him take in firm decision?
Mood cycles, can they become calmer? In fact, that's what he said. The practice of yoga can help ups and downs get better. And the question that you asked.
Yeah, one more question that studies what we discussed about, they are talking about allopathy medicine's continuation along with the yoga. My question is whether there's been any study, we are doing allopathy, yoga and Ayurvedic medications also going on and any improvement in that?
As far as I'm aware, there is one study by Dr. Shirley Tellis and her group looking at yoga and Ayurveda, but there is no allopathy there. This is in people with cognitive deficits, where actually they found that yoga and Ayurveda both had good effects, but yoga was better. This is a study, if I'm right, was published around 7-8 years back, 2005 if I'm right. But allopathy, no, there is not a part in that. All three being together in a single study, no, I have not seen any such study.
Nowadays we are talking about naturopathy also. So
that's what I said, that
yeah, there should be a study because these
He is
elements.
recommending
integration.
doing some such study. Maybe we should do it. It's a good challenge that you have posed. Looks like the organizers have hinting me to close, coffee being served there. I thank all the audience for being with us. I thank the speakers for making very interesting presentations. And I, with this, close this session. Thanks a lot. And there's going to be a panel discussion. Many of you may want to ask questions about mental health and yoga. Please feel free to reserve your questions and bring it up there. Thank you. Thanks a lot. Thank you, madam.
Thank you very much, sir. I would like to thank all our speakers for their wonderful speeches. I would like to invite Dr. Gangadharji to present a token of our appreciation to Dr. Rajesh Sagar. It was a wonderful talk about depression as well as diabetes and its correlations. I'd like Dr. Gangadharji to present a token of appreciation to Dr. Savita Iranti. Thank you so much for a brief overview of all the common mental disorders. Thank you, ma'am. I'd like to ask Professor Gangadharji to present a token of appreciation to Dr. Shriram Varamballi. Thank you, sir. I would like to invite Dr. Sadbir Khalsa ji onto the dais, Assistant Professor of Medicine in Harvard Medical School, to present a token of appreciation to our chairperson, Dr. Gangadharji. Thank you, sir. Thank you, everyone. Tea is being served at the back of the venue right now. And at 4 o'clock, please assemble back for a panel discussion. Any questions you have then can be presented to the panel. Volunteers will be around you to collect your questions. Thank you.